Thank you very much. It really is a true delight and pleasure to be with you this morning. I must say, not only does it feel like coming home, but I am home. And, I say that with some emotion because I don't think you ever leave the place where you grew up. I was actually born in England, and my parents, my father during the war was in the Commonwealth Air Training Command. He spent 6 years in one of these huts in Moose Straw, Saskatchewan. I don't know how he survived, but he did meet my mother, so maybe that's how he survived. And then they moved back to Canada at the end of the war. My sister and I were born over there, and then we came to Vancouver for 1 year and then to Calgary. And I spent a very happy time growing up here. I've had, as you've heard, a bit of a moving around career, and I'm now in North Carolina, but I must say the other places that I've been and worked in my life, they've all been wonderful, and they've all been they've really contributed to my own professional development and my family's development. But at the same time, I've never felt a place that I felt as welcome and where there were as many friendly people as Calgary and now North Carolina. If you come to our home in North Carolina, and I would invite each and every one of you, if you're ever passing through Chapel Hill, to please get in touch with me. I'd love to show you around there, but if you come to our home, it feels like Alberta South, because we also have a lot of Western Canadian art, which is one of the biggest bargains, it seems to me, in the worldwide art market these days. So it's just tremendous stuff, and so it's a pleasure to be here on so many fronts. But I want to share with you sort of my journey when it's been a journey of research into this area of the value and impact of library and information services, because it's something that I think is always going to be something that is meaningful to us, that even though many things are changing, Susan said Scott Pluchak's excellent address at MLA really talked about the golden age of librarianship. We may be moving out of the days of traditional libraries, but we are moving into the golden age of librarianship. And it seems to me a really big sign of that in Canada is the Canadian virtual health libraries, which I must say I had some history with. In the early days, I did a study for Health Canada using the same kind of methodology, looking at the value and impact of libraries for the Health Canada libraries. And out of that came a relationship there for a while with Health Canada. And there was a very responsive Minister of Health at the time who really was interested in libraries and information services and thought they would have a lot to do with improving, healthcare in Canada. And he asked us to do a report that would talk about a sort of a national health library. I had talked to him about what was going on in Britain and the National Library of Medicine and so forth. And so, I've been in North Carolina now for 11 years, so it was before that. In fact, I think we finished the report just after I moved to North Carolina. So it's so wonderful to see that going ahead. And I think it is these sorts of initiatives and these sorts of systems and making the information truly accessible and usable in the future. I mean, the other thing that Scott talked about was, it will also be the age of systems. The systems are lousy. Even though we've worked so hard on library OPACs and all these things, they are still not really good. And we have to make them better. So, as we move into the future, we're going to be using a lot of new knowledge and skills. It's going to be very challenging, and has always been very challenging in our field. Any of us who thought we were going into this because we love books and people, we still love books and people, but we also have to really think innovatively about how we can help move our field ahead and take advantage of the wonderful opportunities that lay ahead. So with that kind of little personal background, let me just talk a bit about a bit of my take on the evolution of value studies and the whole idea of how can we evaluate what our libraries are worth, why our libraries have value within the institutions. I think it goes way back, and I remember when I first got into the field, the big thing was standards for libraries, and we had standards for hospital libraries. CHLA was very influential in coming up with standards for that and for the role of the librarian in providing consumer health information. Lots of different standards, and it was thought that if you met those standards, and these were standards developed by an expert group, the whole field kind of consulted on the development of those standards, that would be enough, that would demonstrate our value if we met those standards. Well, we all know that that may be very nice, but in the healthcare area in particular, and I've always thought that healthcare librarians were on the leading edge, or the bleeding edge, literally, of the field, because we have been challenged so much with the kind of rapidly changing environment that we're working in, and the tremendous demand and tremendous importance of the information that we provide in the healthcare system. So, we've also done things with where we looked at inputs, and inputs were often a part of these standards. You have to have, so many books and so many serials and so many librarians and so many square feet of space and all of that. But all of these are inputs. All of these are inputs. So many databases that you made available. And that's fine, but then what do you do with that? So then we started counting outputs. So how many reference questions do you answer? How many website hits do you have? All of these things, which are numbers, and that you've often heard that phrase, if you can't measure it, you can't manage it. Everybody wants numbers. So we started counting these things. And I can remember so often, the little 4 lines, and then cross it out, and you've got 5 reference questions, and then you write this in something before the days of computers, when we're all sort of entering these things electronically. But we had the outputs, and we thought, well, okay, well, that does it. We know that we've got inputs, and we're making good use of them, and we're using them efficiently, and we've got all these outputs, but not good enough. So then comes along the age in the healthcare system where they start talking about outcomes. And being at McMaster University Health Science Library all those years, I was just embedded in that area, the whole origin of evidence-based medicine, and I know that here in Alberta you have been leaders in the evidence-based librarianship movement. The journal, it's on my reading list for my research methods class, even though it's not a health sciences course. I use what's happened in health sciences and your application of research in your practice to show librarians in other areas, what they should be thinking about, what the future holds for them in terms of thinking about how they're going to demonstrate the value of their services. So outcomes, and that also then gets into impacts. Both of those, we get beyond getting the right information to the right person at the right time, which is all well and good, but what do they do with that information? And does it make a difference, in our case, to patient care, or if you're involved in research environments, to the quality of the research, or the amount of research, or whatever measures you want to apply to research. But we have to move into that. And together, it seems to me, all of these things that have been part of the evolution of value studies, in fact, still have something to do with it, because we can feed these outcomes and impacts back into things like standards and, what we choose to, the inputs that we have and the outputs that we count and things like that. So, exactly what is value? And of course, it's one of these really abstract things. Value is in the eye of the beholder. Is this a valuable conference? I'm sure it will be. I'm really impressed by everything that I've seen so far and the dedication and sincerity of the people organizing this. And I know it will be a wonderful conference for all of us. But what exactly does that mean? What if we value this conference, if we value this association? Well, if you look in the dictionary, which librarians always do, the shorter Oxford English Dictionary said it's worth, desirability, utility, or the qualities on which these depend. So, you can see the direction this is going. And then the second one, a definition says worth as estimated, and I put in brackets in dollars, valuation, power of a commodity to purchase others. And being here now in one of the business capitals of the country, this is a place that's run by dollars. This is a big money place. The oil industry is here, one of our major national industries. And there's this tendency in a system like that, in an environment like that, to say it's all about the money. It's about, will this make money, or in our case, will it save money? It's all about the money. I don't think this is quite good enough. Yes, we're in a capitalist system, and money probably makes the world go round, but there's so much more to it in the human experience than we'll ever be able to count, or that dollars can buy. All of these kinds of approaches, the ones that have been developed, and there are some like return on investment and so forth, which actually count those dollars, they're based on a concept called value in exchange. So it's sort of like putting a dollar value, an exchange value on these services, which is all well and good, and I'm not saying this isn't important, but I think Joanne's definition of value is that to my mind, and what I've always tried to focus on in my research, is the perceived value of using something to accomplish a task or goal. I think it's the human perception of value which we really have to focus on, which will, if people see something as valuable, they are more likely to use it, and it's more likely to transform their own practice. We're talking about our own evolution, our own transformation. Well, it's our own perceptions which are going to guide that. And so for some people who are really into the dollars, perhaps this will not be the quintessential study, but some of what I'll talk about can be transferred into those dollar values or value in exchange. But I'm really talking about something that's more akin to the value of using something. So there's value in use and there's value in exchange. So just by way of background. So I want to share with you this morning, it's the first time I've really had any amount of time to share this study. I did give a contributed paper at MLA, and I had 15 minutes in a wonderful session that also included value papers on a federal library study of federal medical libraries, and also a study on return on investment at the University of Nebraska. But it was very brief, and so this is the first time I've had the chance to really talk in any depth about this. So the purpose of this particular study was to understand the value and impact of information resources and services provided by the library and the librarian on patient care. We actually started with focus groups of librarians, and there were librarians who had actually done an interview of their administrators, because as we know, administrators in healthcare institutions are the ones who hold the purse strings, who make the decisions, who cut the budgets or augment the budgets in the good times, whatever, but we have to be concerned about their perceptions of value. And basically what they told us was that they would value services that had an impact on patient care. That if their health professionals were providing better care, felt they could provide better care as a result of the library services that were provided in the institution, that would represent value to them. So just, that actually confirmed what we had actually set out to do in this group, which was to look again at the original Rochester study that was mentioned earlier, the impact of the hospital library on clinical decision making. It was done in the Rochester, New York area when I was at the University of Toronto, and at that time, they just decided that, they weren't going to insist on hospitals having libraries for Medicare and Medicaid funding in the U.S. if there was no evidence of actual outcomes or impact. And so we set about to do such a study, and many of you are probably familiar with that. But of course, times have changed since 1992. They've changed big time, and other value studies have been done and actually used many of the same value measures that are in the original Rochester study. But we thought that we really had to do a bigger study, for one thing, because so many of our studies are focused on individual libraries or individual, small areas. Rochester was all 16 hospitals in a 5-county area in Rochester, New York, but that's still a far cry from a really large multi-site study in different areas of the country.